Welcome back, folks. This is Dr. Jim Parry, double board certified facial plastic surgeon and fellowship trained facial plastic surgeon. Previously, we talked about a brand new technology out there that's called Embrace RF. The other day, we featured FaceTight, which is a component of Embrace RF. Today, we're going to talk about another component of Embrace RF called Morpheus8. A lot of you folks are probably familiar with a technology called microneedling. Microneedling's been around for a while. Microneedling is where we insert tiny little needles that cause controlled injuries to the dermis. Now, Embrace RF or Morpheus takes that to the next step by introducing radiofrequency energy with the microneedling to give a much more pronounced result. Unlike microneedling, Morpheus8 uses radio frequency combined with the microneedling to get a much more significant result. Essentially, this technology is a fractional technology. It's very similar to a CO2 fractional laser. The little needles in the Morpheus8 are going to cause little injuries to the skin surface down at the level of the dermis. And then we're going to introduce a radio frequency energy. What that does, it causes remodeling of the dermis and an increase in collagen and elastin. Collagen and elastin is what keeps our skin very tight. As we get older, we start breaking down the collagen and elastin. So by introducing the radio frequency at the level of where the collagen is made, we're stimulating new collagen to be formed, which is going to allow for a tighter appearance of the skin, and it's going to allow for a new resurfacing of the skin. Patients are going to have a more youthful look to them, a more glow on their face, and it's going to help to lessen those fine lines that we see on the face as well. But the really exciting part of the Morpheus8, not only does it help to resurface and put that glow on your face, it's going to actually tighten the skin. So it's going to tighten the skin, and it's going to help with those wrinkles as well. Normally, it takes 1 to 3 sessions of Morpheus8 to get the best results. You'll see some results in as short as 2 days. You'll see some good results in about 3 weeks, and you'll see the very best results in about 3 months. As you're going to see from the patient today, it's a very simple procedure. There's really no downtime from it. You might be red for a day or two, your skin, but there's no downtime. There's really not too many things you cannot do, and that's the beauty of it. Okay, so we're going to go in and talk to our patient. Okay, we have our patient in the room, and as you can see, she is Michelle, our licensed esthetician. So Michelle's going to undergo the Morpheus treatment. What you don't know is about 45 minutes ago, we put numbing cream on all of her face to make her nice and numb so she does not feel this procedure, but it's not a painful procedure at all. So what I want to show you here, as we talked about this, I talked to you about how it uses what's called microneedling. Here's the tip. If you look real close, you can see all this array of needles. These are the needles that were actually going to go into her skin. I'm going to determine how deep they go. They go anywhere from 1 millimeter to 4 millimeter in depth. And that's going to depend on the area that we're treating and what our goals are. What we're hoping to do with Michelle is to stimulate some new collagen, new elastin, to give her a much more youthful glow to her face, as well as tighten her skin along the jawline and along the nose hair. It's all set for where we're going to start. And then I'm going to show you here, if you can maybe see this. When I hit the pedal, the needles come out, and that's what delivers the energy. Now you'll see the needles aren't coming out very far because it's set only to go 2 millimeters in depth, because we're going to be treating the forehead, which is bonier. On the bony areas of the face, the forehead, and along the jaw, we decrease the depth of the needles. On the softer areas of the face, we're going to go ahead and increase that depth to get a better result. Okay, Michelle, are you ready?
I'm ready.
All right. As we can see, we're just systematically go into every area that where we see skin. And people may ask, what can we use this on? Well, we can use it on the face and the neck, but this can be used anywhere on the body where you want to get a little bit of skin tightening or of your skin. How do you feel, Michelle?
I feel good. It's very tolerable. We have great numbing cream.
Good. And you can see she's getting a little bit of redness, but that's what we expect. And this is usually going to be gone, usually within 1 to 2 days. Sometimes, and some people, it can last for a few more days. But it's very, but this shows me that we're doing a very good job. Now we've treated this bony area. Now we're going to increase the amount of energy, and I'm going to increase the depth that the needles go to get this more softer tissue of the face. So as you can notice here on the face, when I press the button, we're going to hear 2 beeps. What that means is the needles are going in once, coming out, and going in the second time and coming out. This is called double stacking. It's allowing me to deliver a lot more energy to this soft part of the face where the patient can tolerate it more. And this is going to cause more collagen and elastin synthesis by double stacking. Okay, so we're just finishing up on Michelle. Took about 20 minutes to do the procedure, maybe 25. As you can see, she is a little red, but she's done a very nice job tolerating it. And hopefully by tomorrow, most of that redness will be gone. Definitely in a few days, she can, when can you put on makeup, Michelle?
48 hours.
48 hours. And any other restrictions, Michelle?
No sun exposure. No retinol products.
How long
no
is that?
exfoliating.
How long is that for?
The next week.
For just the next week. Okay, just got to protect your skin from the sun as
Hydrate.
well. Hydrate and avoid any type of bleaching agents on the face. But it's a very minimal, if any, contraindications for the procedure. Well, thank you for joining us here at the J. Parry Clinic, and we hope to see you back soon.